Carolita Jarvis, and you may recognize me from some of my world-renowned masterpieces. You're lucky today because I'm taking the time out from my busy schedule of teaching nurse practitioners to talk to your class. And I'm going to be informing you because I've been made aware that National University makes you buy my book for a regular Bachelor's in Science and Nursing class, so I figured I should take the time to talk to you all. Today we're going to be discussing the case of Mr. X. He's a 54-year-old hypertensive male that was admitted to your unit with complaint of heart palpitations. On admission, you discover that Mr. X's potassium level is 5.4, and also are made aware that he consumes a potassium-rich diet and takes spironolactone for control of his blood pressure. You also discover that Mr. X missed his follow-up appointment a month ago. Using Orm's self-care theory, we will be showing you the proper way to educate a patient with hyperkalemia. Remember that in your practice, you may find these findings, normal findings, or normal variations.
Oh, hey, how you doing? Hey, I'm doing some patients right now, and I'm using one of the best books. If you ever want to be a nurse practitioner, this is the book to use. And I'm not trying to be one, because I am one. So, I'm going through this, referencing, and I'm going to go and see a patient for hyperkalemia. So, why don't you come along and let's see what we have here. Hello?
Yeah, come on in. Yeah.
Hello? Mr. X?
Yeah.
What's up?
Oh, Dr. Dre?
Yeah, what's up?
What's going on?
What's up? What's up? Damn, I haven't seen you in a while.
Oh, man.
So I heard you're having some potassium problems.
I think that's the case. That's the case.
Well, is that what brings you here today?
Yeah, some palpitations and maybe a rectal exam that comes along with it.
You know, I hate to break it to you. I know you probably heard in the hood that I'll be doing some mad rectals. But you know what? I don't. You know, I'm a Dr. Dre up in the turntables, and you know, I can get the doctor. He comes up in here. He does mad. It's him. He's the one that does all the rectals. But you know, I don't do that stuff. I just come here and report. So that's what I'm going to do to you.
Oh, okay.
Okay. As you notice, I'm carrying this Jarvis book. I don't know if you recognize this book.
I heard of that.
For some reason, I've acquired so much knowledge when I went to nursing school because this is actually a nurse practitioner book. That's probably where you thought I can do rectals.
Hey, you know.
But I'm going to put this nurse practitioner book down and we're going to handle what you need to handle today.
Okay.
Okay, so I was looking at your chart. Your chart shows that, you know what, you've got like a high potassium. I heard you just told me that you got some palpitations.
Yeah.
And you got some hypertension.
Yeah.
Okay.
Well, that's why I've been eating the bananas. It's good for you, you know?
Yeah, the only thing is that, you know what, because you're taking a potassium-sparing diuretic, it's kind of making you having a lot of potassium inside your body, which is causing a little bit of your palpitations.
Oh, I didn't know that.
Yeah.
Well, you know, I didn't know that because I've been taking care of my hypertension.
Okay. Well, you know what? That's good. That's good that you're aware of it, and, you know, we're going to just try to correct it for you today.
Okay.
Okay, so one of the things that we're going to have you do is, I mean, how many bananas you be eating in one day, boy?
Well, this is my lunch.
That's your lunch?
Yeah.
That's all you eat is bananas? What'd you eat for breakfast today?
Banana pancakes.
Banana pancakes.
Yeah.
What about, did you try that steak banana they have over at Morton's?
No. I had that banana cue. You know, at Tita's Kitchen, you know.
Okay, well, see, that's the thing. You're going to have to slow down on the bananas. But take your medication.
Okay.
Okay? And you got to keep your appointments.
Oh, all about that. See, I had to do some chores at home.
So you're still doing chores.
Yeah.
Aren't you like 30-some years old?
My mom needs help.
Damn, you still got the chores going. I remember back in the day you doing chores. 30 years later, you still doing chores.
Yeah,
That's good. That's good. That's good. That keeps you focused.
Yep.
All right, so what I'm going to do, I'm going to head on out here. You understand everything I told you? We're going to have you come back in 2 weeks. We're going to check your potassium, making sure you're not still eating a bunch of bananas. Okay? And then we're also going to make sure, you know, that you've still got to do it. You're still working out. You're still trying to get your yolks on.
Oh, yeah.
You know,
No,
doesn't show up in here.
I'm pushing 200 right now.
You're pushing 200?
Yeah.
Is that weight or is that?
No, I eat 200. That's fine. 200 pounds.
Okay.
You know.
All right, as long as you pushing 200 something, weights, it's all the same. It's got W in it.
Yeah.
All right, so I'm gonna go with the doctor. He's gonna run that like mad rectal exam on you. I hope you're ready for it. Hope you brought some candles.
Is it gonna hurt?
Oh, you know what? I hear he uses gloves. So you know what I'm saying?
All right. Well, thank you. Thank you
Yeah,
so much.
anytime.
All right.
So I'll catch you on the flip
All
side.
right. We'll see you in the clubs.
All right.
You just witnessed my good friend Dr. Dre educating Mr. X on the importance of adherence to his medication regimen, the awareness of potential problems, and the need to make changes to his lifestyle, diet, and medication regimen. At the end, his verbalizing of understanding was able to show us that we had effective teaching methods. And as a disclaimer, it has been brought to my attention that students from National University have complained about the clinicians in my videos not wearing any gloves. Well, I'm here to tell you that as long as I continue to make these videos, we will continue to not wear any gloves. Please play.